Sciatica is a common complaint, and we can either have just numbness and tingling down one of our legs, or we can have associated low back pain with it. And online there's a ton of different exercises for sciatica. And so here's one exercise progression that we can use, which is kind of separated into two different categories. So we have a couple of exercises that are used to help decrease some of the sensation of numbness and tingling down the leg. And then the second part is actually strengthening, so both for the glutes as well as the core muscles. Let's briefly discuss some of the causes of sciatica. So sciatica is just the term that we used for irritation of the sciatic nerve, and there are a couple things that can generally cause it. Probably the most common is a disc herniation. So if we look at the spine here, the lumbar vertebra are the last 5 vertebrae here, and in between each bone we actually have an intervertebral disc, which is this little portion right here. And so we can see here this actual little red piece of this intervertebral disc represents a disc herniation. And with sciatica, it can compress parts of the sciatic nerve, which gives us some of the numbness and tingling that we might experience down the leg. Another cause of sciatica is piriformis syndrome. And the piriformis is a muscle underneath the glutes. And it either sits right on top of the sciatic nerve, or the sciatic nerve actually goes into the piriformis muscle. And so if that muscle is in spasm, it can cause compression on the sciatic nerve, replicating those same symptoms of numbness and tingling down the leg. The conservative treatment of sciatica caused by a disc herniation compared to sciatica caused by piriformis syndrome are fairly the same, but for a disc herniation we might do a little bit more low back focused rehab versus piriformis syndrome where we might do a little bit more hip and glute focused rehab, but there's a lot of overlap between the two. So the first exercise we'll do is called sciatic nerve flossing. And so it's important to know that when we're doing nerve flossing, that it's not a stretch. So we're not actually trying to stretch the sciatic nerve. What we're actually trying to do is mobilize it. So we're trying to just shift it from one direction to the other. And so when we're actually doing nerve flossing, we don't want to experience numbness, tingling, or pain. We really shouldn't feel anything besides just movement while we're doing this sciatic nerve flossing. And so what it ends up looking like is that we're going to be sitting, and so whatever leg that we're actually experiencing the sciatic nerve symptoms in, that's the leg that we're actually going to move. And so what we're going to do is we're going to look up towards the ceiling, and then bring our leg up, extending that knee, and then we're going to reverse the motion, so we'll look down towards the ground, and we'll flex our knee here. And so when we get to the top, we can point our toes up towards us. That'll put a little bit more tension, drawing the sciatic nerve down towards our foot. But again, we don't want to experience any numbness and tingling while we're doing this. So if we do, we can actually just keep our toe pointed away from us. That way we have a little bit more slack in the sciatic nerve as we're going through this movement. So essentially, again, we're going to look up towards the ceiling here, and then down towards the ground. And so when we do this position, we're actually pulling that sciatic nerve down towards the foot. And then when we reverse that motion here, we're actually pulling it up towards the low back. This second exercise is a press up, and it's used more so if the sciatic nerve is being irritated by a disc herniation. But even if you're experiencing sciatica because of piriformis syndrome, this exercise still might be helpful, but typically it's used for a disc herniation. And so what you're going to do is you're going to lay on your stomach on the ground. And so the first part is that what we'll do is we'll actually just press up to our elbows. So what we'll do is we'll start here, and then we'll push up. And so we're trying to keep our pelvis on the ground and just lift our torso up off the ground, so we're extending through that low back. And then we'll slowly go back down to the ground, and then we'll do this for reps. If we can tolerate that okay, and we want to progress this, we can actually go up into our hands and go into like a cobra pose in yoga. And so what it'll look like is we'll go to here, and then back down. And so this is another exercise that we can use to help calm down that sciatic nerve if it's really irritated. Sometimes with sciatica, we'll have what's called a lateral bend. And so let's say there's pain on this right side, maybe due to a disc herniation or just pain and discomfort on this right side. Our body will actually shift away from the pain. And one of the reasons why this can be is if we have a disc herniation on this side, bending to the side actually opens up the intervertebral foramen, which is where your nerve roots come out. And so it gives it a little bit more space if this nerve root is irritated. But once we can start to tolerate some movement, we actually want to get some of these muscles on this side to start to engage, and that's where I'll actually add in a side plank, typically from the knees, just to start activating some of those muscles. It's okay that if we're in that side plank position, if we're still bent away just a little bit, because we're just trying to get some of those muscles to engage. But eventually we do want to get rid of that lateral bend so that the spine is a little bit more straight and that we're not constantly in this position. And so the progression is to start with the knees stacked, elbow underneath shoulder. And what we're going to do is we're going to press our shoulder away. That'll help engage some of the rotator cuff muscle. And then what we'll do is we'll actually just press our hips straight forward from here. And then we'll hold typically for 10 seconds. Like I was saying before, it's okay if we actually don't lift that hip up too much. If this side is the irritated side, we just want to get a little bit of engagement of the lateral core and some of the glute as well. But if it's tolerated, it's okay to bring that hip up and hold this into a normal side plank. We can also progress this where we're actually on our feet. This makes it a little bit harder because the lever is a little bit longer. And then again, we'll just hold this for 10 seconds. Once the sciatic nerve isn't quite as irritable and we can start to move around a little bit more, we'll start to do some strengthening of the glute muscles as well as the core muscles. And so one of the first progressions is a glute bridge, mainly targeting those glute muscles. And so what we'll do is we'll lay on our back, hands at our side, and then what we're going to do is we're going to squeeze our glutes, push up off the ground, and then slowly back down. And so at the top of the motion here, we want to have good alignment between the knee, the hip, and the shoulder. So that way we're getting full extension through the hips. Sometimes with the glute bridge, we'll cue people into pushing that low back down into the ground, and that's meant to decrease any extension through that low back. However, typically with sciatica symptoms, it's worse when we actually bend forward, so we actually don't want to bring our low back into more flexion. We might actually want to keep it more extended. And so instead of, if we put our hands underneath our back, pushing down against the ground, which will bring that low back into a little bit more flexion, we actually might want to keep it where it is, either a neutral or a little bit more extended, so we don't irritate that sciatic nerve. So instead of pushing that low back down against the ground, we'll actually just brace the core either in neutral or maybe a little bit more extended, just so we're not irritating that sciatic nerve. When it comes to strengthening the core muscles, there are a variety of different exercises that we can use, and there's not one specific exercise that we need to use for core strengthening when it comes to sciatica symptoms. But a common set of exercises are planks, those side planks that we did before, glute bridges, as well as either a dead bug or a bird dog exercise. For the plank, we'll start off in that same position that we were doing the press-ups in. But what we'll do is we'll have our elbows underneath our shoulders, and then we'll have our feet together with toes tucked underneath. And then what we're going to do is we're going to squeeze our glutes and lift up off the ground so that our shoulders, hips, and ankles are all in a straight line. And so we'll go to here, and in this position we'll hold for 10 seconds and then repeat for multiple repetitions. For the bird dog exercise, we'll start in a quadruped position with our hands underneath our shoulders and our knees underneath our hips. And so there's many progressions and variations that we can do from this position. The first one is just to lift up our arm. So what we're going to try to do is just lift up our arm up overhead and then come back down and then switch. So what we're trying to do is we're trying to work on motor control with this exercise. So we're trying to maintain a neutral spine, and that when we're actually extending, we're not extending and moving through that low back, but we're actually learning to brace, stay in that position, and then move our extremity around it. And so the next progression is actually just the opposite. So instead of moving our arms, we're going to move our legs. So everything remains the same, but we're going to extend and push our heel back behind us, and then come back, and then switch to the other side. And so two main things with this is that we want to be aware if we're rotating through the pelvis. And so we don't want to lift up our leg like so. We want to try to keep this flat and just push that heel straight back behind us, and then come back. Same thing on that other side. The other part is that we want to try to control our low back. And so a common mistake that we do is that when we're here, we actually extend through that low back. We're trying to just isolate the hip joint. So in the same position, just move through that hip and try not to move the low back. And finally, we'll do opposites. So we'll move our arm and our leg at the same time. And so what we're going to do is I'm going to move my right arm and my left leg, and then back, and then switch. For the dead bug exercise, it's very similar to the bird dog, except we're actually going to be laying on our back. And so the goal of this exercise is very similar in that we're trying to control our low back while we actually move either our arms or our legs. And so what we'll do is we'll start in this position, we'll lift our legs up off the ground and arms up in the air. And so again, the first progression is just to move our arms, so we'll bring our arm down, try to touch the floor if we can. The next progression is again just legs. And so we're going to bring our leg out and then come back up and then switch. And so if that's too challenging, we can actually keep our knee bent. And so what we'll do is we'll just tap our heel down to the ground and then back up. And then finally, the last progression is to again move opposites. And so we'll move opposite leg, opposite arm. And so when we're doing this, again, we're trying to keep a nice brace through that low back and only move whatever joint we're trying to move. So either our arms, our legs, or opposite. Thank you for watching this episode on exercises for sciatica. I hope that you found the exercises useful. If you did, go ahead and give this video a big thumbs up. If you want to see more of my content, go ahead and hit subscribe. And if you want to be notified of future videos, hit the bell icon as well. See you guys in the next video.